Part 1, Deafblind, acronym DB, by Dr. Marty Harris. This presentation includes audio that reads the slides. Therefore, closed captioning will not be used. Federal definition of deafblindness means concomitant hearing and visual impairments, the combination of which causes such severe communication and other developmental and learning needs that the person cannot be appropriately educated in special education programs solely for the children and youth with hearing impairments or severe disabilities without supplementary assistance to address their educational needs due to these dual concurrent disabilities. National Technical Assistance Center definition of deafblindness. If the deficit in hearing and vision is sufficient to require special adaptations in instruction in both auditory and visual modes to produce maximum learning, then the person qualifies to be identified as deafblind and should be included in the annual census. A person needs, at a minimum, to have a visual acuity of 20/70 in the better eye with correction, and an auditory deficit of 30 decibels, dB, in the better ear. Prevalence, very low incidence disability. Quote, the overall December 1st, 2015 snapshot count increased to 9,574, an increase of 190 from 2014. Overall, the total number of children and youth served during the year also increased from 10,471 to 10,671, end quote. This was from the National Center on Deafblindness 2015 report. Quote, while 1,130 children and youth exited from the censuses of state and multi-state projects, a total of 1,335 were added through Child Find and referral efforts. Quote, newly identified children and youth spanned the age range from birth to 21, end quote. Prevalence, very low incidence disability, continued. Quote, newly identified children and youth spanned the age range from birth through 21. Nearly half, 47.9%, were birth through 5 years of age. In other ways, these newly identified individuals mirror the overall population. The distribution of children and youth across age groups has remained relatively stable over the past 5 to 6 years, with a slight shift toward a younger overall population, end quote. Prevalence, very low incidence disabilities, continued. Quote, all of the ethnicity categories except white continue to increase. The number of children and youth identified as white continues to decrease. A notable exception is that the numbers of children ages birth through 5 who are identified as Hispanic, Latino has decreased over the past 6 years, The distribution of children and youth by gender has remained very stable over time, with about 54% of the children and youth being male and 46% being female. Deafblindness and Other Disabilities. Quote, many children who are deafblind have other disabilities, including 66% with cognitive disabilities, 57% with physical disabilities, 38% with complex health needs, 9% with behavior challenges, and 30% with other complications. End quote. Deafblindness and Other Disabilities continued. Quote, more than half the deafblind population have Usher syndrome, which is an inherited condition. Individuals with Usher syndrome have progressive sensory motor deafness, retinitis, pigmentosis, in other words, vision loss, and central nervous system problems. End quote. See this website, https://www.nidcd.nih.gov for more specific information on Usher syndrome. Diagnosis and assessment. Diagnosis involves the medical field and specific disabilities expertise, such as hearing impairment, physician and audiologist, visual doctors including ophthalmologists and optometrists, physicians that specialize in deafblindness or any of the concomitant disabilities the individual has, deafblindness special educator, and orientation and mobility O&M specialist. Assessment of functioning may require several related services experts, such as occupational therapist, physical therapist, speech and language therapist, assistive technology specialist. Changes may occur as interventions progress. Therefore, ongoing assessment is necessary. Etiology. Prematurity is a common known cause of deafblindness. Genetic causes. In 1994, only 18 different syndromes identified. In 2007, 60 genetic causes identified. Usher syndrome includes deafness, blindness, IDD, and motor difficulties. Recessive X-linked genetic syndrome, and it is rare, 3 out of 100,000. Remember the story of the death on Martha's Vineyard that told of the genetic links to deafness? For Usher syndrome, it has been found that Cajun families in Louisiana carry the gene for Usher syndrome. References: Friend, 2018, Hallahan, Kaufman, and Pullen, 2009, Eward, Albert-Morgan, and Conrad, 2017, Smith and Tyler, 2010, Taylor, Smiley, and Richards, 2009, Turnbull, Sjogren, and Weimeyer, 2016, Vaughn, Boss, and Schwum, 2006. This presentation is copyrighted by Dr. Martha Jane Harris, 2017, 2012, 2005, 2000, and 1998. Thanks for listening.